Connecticut Spotlight is brought to you by the Center for Advanced Reproductive Services.
Welcome to Connecticut Spotlight. Today we're at the Center for Advanced Reproductive Services in Farmington talking about how infertility impacts men. Doctor, thanks so much for having us out today.
Oh, thank you for coming, Jackie, and welcome to the center.
Thank you so much. So I think a lot of people think about infertility and they think women, but it can also affect men. How common is it?
It's more common than people might think. We see couples where roughly 30 to 40% of couples are affected by male factor infertility, and another 20% may have multiple factors. So if you look at it, the male alone is contributing to the cause of infertility roughly 40 to 50% of the time.
So what are some of the causes of this infertility?
There's several causes for male factor infertility. There can be structural problems, anatomical problems. A male might have had an injury before or an infection that can cause an obstruction. And sometimes there's a hormonal or a genetic cause that can be detected by a simple blood test.
And what are some of the treatments that you offer here at the center?
We start by a basic semen exam, so there's really not any invasive testing initially, and we can usually find out the cause of male factor infertility. One of the common anatomical problems is something known as a varicocele. So it's where there's dilated veins around the scrotum, and that can be corrected with surgery or infertility treatments that we can offer that can address the male factor infertility.
And doctor, I would think a lot of men are a little bit hesitant to come to the center. What would you say to those men?
I think it's a lot less invasive than people might think. We start by a simple history and then a semen exam before we do more invasive testing.
Thank you so much for having us today.
Thank you for coming.
And thank you for watching. We'll see you next time on Connecticut Spotlight.
Connecticut Spotlight is brought to you by the Center for Advanced Reproductive Services.